Now we're about to actually go into studying about congenital heart diseases. So in studying about congenital heart diseases, we're trying to first of all address the learning objectives and the course outline so that students will know what they are expecting as we are about to start this congenital heart diseases series. Okay, so for congenital heart diseases, let's quickly look at the learning objectives and the course outline. So learning objectives is like basically what you are expected to know. Do you understand? After we are done with this series, okay, so I expect what by the end of the course you should be able to understand cardiac embryology. Your knowledge of how the heart developed should be very, very sharp. Okay, you should be able to describe the normal heart development. So how the heart should have developed normally without issues. Then you should also be able to what? Address why issues came in. Do you understand? You should be able to classify congenital heart defects that's into what? Acyanotic and cyanotic. Acyanotic are the ones that will not make the skin of the baby turn bluish. Cyanotic ones are the ones that will make the skin of the baby turn bluish. The baby will be having all those teeth spells and all. Then you should be able to recognize lesions that will increase pulmonary blood flow. That's like issues in the heart that will make like blood flow to the lungs to be too much than the lung can handle. Then issues in the heart that will reduce what blood flow, okay, to the lung below what the lung is needing. Okay, so you should be able to identify common congenital heart defects. So we now spend time talk about some common congenital heart defects that you always see in the hospital. Like all this, atrial septal defect, ventricular septal defect, tetralogy fallow, transposition of great arteries, coarctation of aorta. We'll talk about all of them. Then you should be able to interpret all those lab results that will come up if you are suspecting that a patient has, congenital heart defect. To send some samples to the, lab. Okay, so what was the possible result you are expecting? You should be able to formulate management plans. Okay, all those medical, surgical. Even if you can't do it, at least you should be able to say it. You should be able to communicate effectively. Okay, so you learn the skill of history taking, so that I can be able to communicate to the patient, can be able to communicate to a family that have a child that actually has these issues. You'll be able to you learn how to apply evidence-based practice. Okay. Then for the sample outline, we look at introduction, look at epidemiology. That's how these issues has affected the world at large. Okay. All those statistics, we look at this. Then overview of heart anatomy, just to refresh our memory. We'll classify it. Okay. Diagnostic approaches. We'll talk about various ways in which you can be able to diagnose congenital heart issues. All this echocardiography, magnetic resonance imaging, CT imaging, cardiac catheterization, everything. All right. Then we'll talk about some common congenital heart defects: atrial septal defect, ventricular septal defect, patent Ductus Arteriosus, tetralogy fallow. All of them, we'll talk about them. Then we'll still talk about some surgical ways in which you can be able to correct, because those issues range from maybe there's a hole where there's not supposed to be a hole, or a blood vessel is now growing where it's not supposed to grow. Do you understand that kind of thing? So most of those issues, if you try to give drugs and you don't solve it, you can just go in for surgeries where they now structurally correct what is wrong. So we'll talk about growth and development, exercise tolerance, and all of that. Okay, so this is what you'll be expecting as we're about to go into talking about congenital heart defects or diseases.